Adult and pediatric emergency drugs. Make sure to go to the oxygen slideshow at your leisure after this class is over. Emergency drugs for cardiac disorders can include a variety of things. One is lidocaine. Lidocaine is great with ventricular ectopy. It's one of the things that we're actually going back to in the ACLS protocol. Verapamil is a calcium channel blocker, and it too is an antidysrhythmic. Amiodarone is also an antidysrhythmic. Adenosine is given for tachycardias. In particular, it's given for SVT. That's what it works on. Atropine is given for bradycardia. Epinephrine is given for a variety of things. But when the heart is in fibrillation and you're trying to jumpstart it and get it going, epinephrine might be a useful tool to administer to excite the heart. In emergencies, fight or flight goes into play. So the sympathetic response is kicked in. So when anybody receives any of these medications, whether or not the medications are aimed at the sympathetic response or not, oftentimes you're going to end up needing to do some things because of the state of the patient not being as aware and alert, and their body is also going to be in fight or flight, that sympathetic response. Things like refrain from feeding them until they're passing flatus, and refrain from feeding them until they are alert and able to swallow. Many times you'll need a catheter for these patients because they are not going to be conscious and they aren't going to be controlling that. Also, their fight or flight is kicking in, and so they're going to have some urine retention. So good thing to know that fight or flight is going to kick in when somebody feels quite crummy. And this is possibly the worst that anybody could ever feel being in a code situation. Emergency drugs for poisoning. You should know reversal agents. You should know that opioids will give Narcan to reverse. Digoxin overdoses, we can give Digifab. Oftentimes, though, if they don't have a reversal agent, oftentimes we treat the symptoms. You will say, well, I've heard of charcoal. I've seen charcoal. Charcoal is a very dangerous thing, and it only works within that first hour, really, of ingestion, because whatever went in the stomach has passed out of the stomach by the time the charcoal gets in there after an hour. So it's really important to know when they ingested it, and you don't often know that. Anyway, poison control, this is the Mr. Yuck sticker. It will give you poison control, which is a doc down in Hennepin County Medical Center in the ER, and they'll help you out with this. We do not, and you need to put this in your notes, we do not use syrup of ipecac anymore. We do not induce vomiting. Emergency drugs for shock are discussed a little later. Emergency drugs for hypoglycemia we have discussed, things like D50 and glucagon. These are important drugs to know that they exist. There are emergency drugs for hypertensive crises and pulmonary edema, there are 2 drugs I want you to look up as far as hypertensive crises. Just know what they're for and what vitals you need to check and what's dangerous about them. Later on, we'll discuss some of the details of drugs for hypertension and drugs for fluid overload. For hypertension, I want you to look up hydralazine, HYDRAL, I think it's AZINE, versus metoprolol, and understand why we give one over the other. What situations would we give one? What situations would we give another? And then in this picture to the right here, this person's in some pulmonary edema, and you can see that the lower lobes are filling up with pulmonary edema. This one's 2/3 the way up. It's pretty extensive pulmonary edema. And they need something like Lasix as long as their kidneys are functioning okay. If their kidneys are not functioning okay, then the equation becomes a little bit more difficult.